Hey guys, what's going on? My name is Tyler. I'm a registered pharmacist with Pharmacy Update, and today I want to discuss a drug that I dispense quite a bit of, and that is Loratadine, or brand name Claritin. If you or someone you know takes this drug, this information might be helpful to you. I'm going to cover some general information about Loratadine, what the side effects are, dosing guidelines, and also I'll discuss if it's considered safe to use in pregnant or breastfeeding women. So let's get into it. So first, just some general facts on Loratadine. It is used to treat allergic rhinitis, also known as allergies, and it can also be used to treat itching due to hives. It is in a class of drugs known as the second generation antihistamines, along with Zyrtec and Allegra, and these are known as the non-drowsy antihistamines. This is because they cause much less drowsiness when compared to first generation antihistamines, such as Benadryl. And if you've ever taken Benadryl before, you know that it is very sedating, and it's even used in some over-the-counter sleeping medications. Also, these drugs are generally believed to not work as well at relieving symptoms when compared to nasal glucocorticoids, such as Flonase. So if you are taking one of these and it's not quite getting the job done, and you haven't tried a nasal spray yet, you may want to do that. Loratadine is available as a prescription from your doctor, or you can buy it yourself over the counter. One nice thing about Loratadine is it does normally work quite quickly. The manufacturer says you can see effects as soon as 1 to 3 hours, but usually you will start to notice some relief as soon as 15 minutes to 45 minutes. The peak antihistamine effect will be seen at 8 to 12 hours, and another nice thing is that it does last all day, 24 hours plus. Now, compared to cetirizine, brand name Zyrtec, there is usually less drowsiness associated with Loratadine. No real difference between this and Allegra. And one other quick fact, if you or your child has an allergy test coming up, you're going to want to stop this at least 48 hours before that appointment. And that's really true for any antihistamines that you take. Now on the side effects, some pretty common ones you could see is headache and sedation. And even though it is known as a non-drowsy antihistamine, some people still do experience drowsiness, but it is not very common. Only around 4% of people will have this. You could also have a dry mouth possibly. Specifically for children, there are reports of feeling nervous in around 4% of kids. And you could also rarely see nausea and vomiting. As far as dosing is concerned, it's pretty straightforward. If you are an adult, you'll usually take 10 milligrams once a day. Some people do opt to take 5 milligrams twice a day, but I personally prefer just once a day, so it's easier to remember. And it is approved for children over the age of 2. If your child is 2 to 5 years old, the recommended dose is 5 milligrams once a day. And this drug is available in liquid and chewable forms if they cannot swallow tablets. If your child is 6 years or older, they will just take the normal adult dose of 10 milligrams once a day. And let's say your allergies are worse than normal, taking a higher dose of this will not make the drug work any better. So you may just have to add a different medication in that case, such as a nasal spray. Now for people with kidney impairment, there is kind of some conflicting information out there. You may need to take the normal dose every 48 hours instead of 24 if you have kidney impairment. And if you are on dialysis, you will want to take it every 2 days instead of every day. For people with liver impairment, they just say to use caution because much of the metabolism of this drug is done by the liver. So you may have an increased level in your blood if you have liver impairment. And my final topic, can you take this drug if you are pregnant or breastfeeding? It is a Category B drug for pregnant women, which is good. The use of Loratadine has not been associated with any increased risk of major malformations for the fetus, and it is generally seen as a safe drug to take while you are pregnant. And personally, I would feel comfortable recommending this to someone who is pregnant if I was practicing myself. As far as breastfeeding, it does cross into the breast milk. However, your child will only get around 1.1% of the dose that you take which is generally considered safe. Just be sure to monitor your baby for any irritability or excess drowsiness. And if you need to take an antihistamine while you're breastfeeding, you're going to want to either take this or cetirizine over fexofenadine or Allegra. And the reason for that really just is because we have more safety information on these two drugs when compared to Allegra. So that's all I have for you guys. I want to thank you for watching. If you would like to see more videos like this in the future, please subscribe to my channel. Also, please comment with any questions or concerns that you may have. So thank you again for watching, and have a great day.